Okay, so on to the webinar. So here at Lymphoma Australia, sorry, that's what we call it. All of the staff are always listening to the needs of the patients, whether it's answering calls or emails or moderating the Facebook groups and even in support groups. There always seems to be common themes that come up that patients are struggling with, whether they are in the midst of treatment, having chemo or some immunotherapy, or maybe they're on watch and wait, or even they're post-treatment. Most of the problems that come up are the same. So we get questions about, can I exercise? What do I eat? Such and such told me to try this diet and it would help. My relationship's affected and I can't sleep very well. So what we've tried to do today is combine some of the best experts in these areas for you into one session so that you can get the most out of it. Please don't stress about scribbling notes throughout the presentations, as each of these sessions are recorded and they'll be uploaded to our website next week for you to go back and watch as many times as you need to. So today, just sit and soak in as much as you can and go back to them later. Okay, we start today with Jake, presenting on managing sleep and practicing healthy sleep behaviours. Jake Garvey is a registered psychologist, currently undertaking his clinical registrar program. He currently works at Peter MacCallum Cancer Centre, where he has been intermittently for 2 years after first starting as a clinical intern in 2020. Jake works with adult patients at Peter Mac from all walks of life with different diagnoses and different points in their cancer journey. He finds purpose and meaning in helping people navigate what is often the most confronting and challenging time of their lives. So welcome, Jake, and thank you so much for presenting for us today. Go for it.
Thank you, Lisa. Great to be involved in what sounds like it's what sounds like it's going to be a really great day for everyone, getting so much information. Everyone should be really happy that Lymphoma Australia has put all this together, because some of the things you mentioned are concerns that we hear all the time at Peter Mac, and having access to this sort of information is invaluable for patients. So I'll just start sharing my screen. As Lisa said, my name is Jake. I'm a psychologist at Peter Mac. Today's presentation from me is all about getting a better night's sleep and understanding some of the sleep problems that might present in the course of cancer, lymphoma, and building an understanding and hopefully coming away with some strategies that might help you alleviate some of the problems that you might be having. So the focus of this session is to look at some of the cognitive and behavioural strategies of managing sleep, which the evidence actually shows is a lot more effective than medication, even though medication often seems like the most obvious fix. So sleep problems, as I mentioned, are very common in all people, especially those confronting health concerns such as lymphoma, and they show up at all different points of someone's journey. So I understand with lymphoma specifically, a lot of symptoms can impact sleep in that watch and wait period, such as hot flushes or itch, and that actually commences before anyone starts active treatment. So having a good understanding of these is applicable to people at all stages. So sleep problems can also affect partners and vice versa. So I hope after today you go away with and share this information with your family and your partner, as it often takes a real joint effort to work on some of these problems. So left untreated, sleep problems can turn into a bit of a vicious cycle that can perpetuate over many years and impacts various other aspects of people's lives. So much of the information that will be presented today comes from the Can Sleep program, which is a program that was designed by experts from Peter Mac, the Royal Melbourne and Royal Women's, and it utilises a CBT framework, which is cognitive and behavioural therapy, So the way we present this information to patients at Peter Mac is in the form of an extensive booklet. So people can take this home and use it as a resource. And it's a really good resource to help as the first step for treating poor sleep. So this booklet can be easily downloaded from the Peter Mac website. So again, no need to be scribbling down notes. And there's a lot more information in the booklet than that's on this slideshow. So I would certainly suggest anyone who's interested to go away and download the booklet and have a look. And I'll put a link up at the end of the session. So firstly, it's really important to understand some of the factors that determine sleep, because if you're not getting enough sleep, having an understanding of these factors will give you the best chance to firstly address them and hopefully overcome some of these issues. So the first main factor is sleep drive. So what sleep drive is how hungry our body is for sleep. So when we go to bed at nighttime, we ideally want to have a high sleep drive. So we really want to be sleepy. So some people take naps during the day, which for some people is really important if they're at that stage of their treatment. But what naps are is it's kind of like snacking before a big meal. So it might actually reduce your sleep drive and may mean that it's more difficult to fall asleep or stay asleep at nighttime. So we'll come back to this periodically through the presentation because there's a lot of things that can impact sleep drive. So second is our circadian rhythm, often known as our body clock. So this is an internal mechanism that tells our body when we should be awake, sending alerting signals to our brain and our body. And the ideal body clock wants to keep us up during the day and starts to wind us down at nighttime and prepare for sleep. So there's a number of different factors that contribute to accurately setting this body clock. The most significant one being light. So ideally our body clock wants to be as close to the day and night cycle as possible. So when it's dark, our body should want to sleep, and when it's light, our body should want to be awake. So using light as an important cue is a really good way to set our body clock and maintain healthy sleep routine. So obviously in the world we live in, there's a lot of involvement with screens and electronics at nighttime. So sometimes these can mimic our body's response to sunlight. So it's important to have a good understanding of the impact screen time can have on sleep. But we'll talk about this as we go. So other cues that contribute to our body clock is our body's capacity to regulate things like mealtime, exercise, daily routine. So all these things program our body clock. So think about the routines that you might have and how this might be either helpful or unhelpful in programming your body clock. So the third important thing is the importance of having a quiet mind. So it's normal as a human to have periods of time where we might be more worried or excited or busier than normal. And of course, when we're going through cancer treatment, you often have a lot more things to worry about and to think over. So unfortunately, this extra activity in the mind can override the normal cues to sleep, such as sleep drive and body clock. So knowing a little bit more about how to manage your mind and the thoughts that promote quietness of mind can be another important factor. So additionally, other things such as the environmental factors, your pajamas, your bedding, the temperature of your room, how much noise there is, how much light there is in your bedroom are really good things to consider as well, which we'll touch on as we go. So the common types of sleep problems, so difficulty falling asleep, difficulty staying asleep, early waking, or excessive daytime sleepiness, and often a combination of all of these can show up at different points in people's journey. So acute insomnia is often short-term and situational. So this can be in a health context, something like when you're waiting for a scan or you're changing treatment or you're in hospital, something that's abnormal and short-term in nature. So what we know is often once these periods of time have passed, people's sleep often reverts back to normal. The other kind of sleep problem is what's known as chronic insomnia. So this is when there's been so much going on that someone's sleep gets into a problematic pattern And we find that this forms an unhelpful habit, which continues over time and may start to impact on other people's life in terms of their mood or their ability to think clearly or engagement in enjoyable activities, which is something that's really, really detrimental sometimes for people's well-being overall, and it's something that certainly should be addressed. So this is a good visual of what I mean by the vicious cycle of insomnia. So as you'll see, it's a circle. So what usually happens is sleep is disturbed for whatever reason. And then when sleep's disturbed, people are more likely to lie there in bed and get frustrated and think about how tired they might be the next day. And that frustration actually makes it less likely that you would fall asleep. And that inevitably means you get less sleep. And then the next day you might be tired and grumpy. And then because you're tired and grumpy, you might have a nap or an extra cup of coffee. And then that obviously impacts your sleep drive or your body clock. And later that night, it's less likely that you'll fall to sleep easier. And the cycle continues. And the longer it continues for, often the worse it gets. So in addition to the nap and the cup of coffee, sometimes in psychology, we talk about safety behaviors. So safety behaviors are behaviors that may alleviate a problem in the short term, but in the long term, they may actually be contributing to the ongoing cycle. So in this context, it may be something like skipping exercise or eating some junk food or something after a bad night's sleep due to having low energy levels, or cancelling a dinner with friends because you're fatigued or grumpy. So this may make you feel better in the short term, but in the long term, it may lead to lower sleep drive, feeling more restless, or having a critical mind and being overly down on yourself. So it's important to notice if you're engaging in any of these safety behaviors. So all that might sound scary and there's a lot to think about, but what I really want you to take away from this presentation today is these things can be improved. So some of the cognitive and behavioural strategies I'll talk about today have been found to be extremely successful in treating people with sleeping problems, including those with cancer. So it's important to take a multi-pronged approach. So identify all the factors and address all the factors, because just as different things can contribute to sleeping problems, it takes addressing a few different things to ultimately see some change. And really committing to 4 to 6 weeks of change. It won't happen overnight. Sometimes our bodies, when they're out of rhythm, it can take a bit of time and some dedication to getting back into rhythm and building new habits and seeing some improvement. So one way people identify these factors is sometimes using a sleep diary. So here's just a quick example of what a sleep diary might look like. There's some have heaps more information on them. Some are just what time I went to bed, what time I woke up. So some people find this helpful because it gives us really good data about what sort of factors and what sort of patterns might be contributing to a better night's sleep or a worse night's sleep. So, for example, what meals did I eat? How much did I exercise? But it's important to take this with a grain of salt, because some people find that adding additional admin and focus around their sleep actually turns it into a bit more of a daunting thing and actually contributes to the stress associated with sleep. So it can be helpful for some people, but yeah, make sure, as with all of this information, to just to see what's best for you. Okay, so getting into some of the strategies, the first thing I want to talk about is the thoughts that you may have about sleep. So I would encourage you to think about what kind of thoughts and beliefs you have when it comes to sleep. So are these accurate? And even if they are accurate, are they helpful? So this is a trap that people get into when they're having sleep issues, and they start to really worry about sleep and it becomes a real focus, and the unhelpful thoughts and beliefs dominate their thinking. And as we've discussed, sometimes the more stress and the more worry that you have about sleep actually makes it less likely to sleep. So an example of an unhelpful belief may be, I need 8 hours or I can't function. So I'm sure you've heard that said before. I've said it before. And on average, this is probably accurate. But what we do know is that some people function really well on 4 or 5 hours sleep. And for other people, more than 8 hours is actually optimal. So what's right for you may be different from what you think you should be getting. So an example of a strategy here, once you've identified some unhelpful thoughts, even if they are accurate, is to start to notice them and challenge them and replace them with something a bit more manageable and a bit more calming. So for example, challenging the thought of, I won't be able to function tomorrow unless I fall asleep soon, with something like, I might be tired tomorrow, but I've been tired before and I've got through the day okay. Of course, it's easy to just say, change your thoughts when you're lying there, especially in the middle of the night where it's dark and it's cold. It's easier to get caught up in those thoughts. But just to start to notice them and start to just get into the practice of noticing yourself having these thoughts and trying to come up with a bit more manageable version of them is a really good start to reversing that vicious cycle. So the next strategy I'm going to talk about is a very important one, and we know it works really well for people with insomnia whose bodies have actually learned not to sleep when they're in bed. So insomnia, as I've said, is when your problems have been going on for a period of time that your body actually starts to associate bed with trying to sleep rather than actually sleeping. So it's important to retrain your body to associate bed with sleep. And an effective way to do this is to avoid any non-sleep related activities in bed. So stop watching TV, reading a book, texting, sending emails, whatever it might be. So try and do all these things outside of the bedroom. And obviously this has been hard in the current situation with COVID, but this is a really important strategy and something that we almost always recommend for people. So the same holds for naps. So if you are at a period of time when napping is helpful for you, make sure you are napping in your bedroom rather than on the couch or somewhere else. So it's again reinforcing the body's association with bed and sleep. So additionally, another strategy is to avoid watching the clock. So a lot of people get into the habit of watching the clock, quickly doing the maths in their mind and figuring out how many hours it is before their alarm goes off and what this will mean for their health or productivity the next day. So it's actually very unhelpful, and checking the clock will actually make you more alert. So if you do need to set an alarm for work or get up for something, so set your alarm and put your clock out of sight. If you wake up during the night and it's dark, then there's a good chance you don't need to be up yet. And you can go through some of the calming strategies that we'll talk about without checking the time. The second strategy building on this is to not to stay in bed awake for more than about 30 minutes if you're not sleeping. So if you don't fall asleep after about 30 minutes, you may be starting to reinforce this idea within your body that bed is not for sleeping. So if you can't sleep after 30 minutes, get out of bed, go to another room. Some people might say this is counterproductive, thinking it will wake them up more, but it might. But in the long term, staying in bed is likely to make you more frustrated and be more unhelpful, and as it continues to build that relationship between not sleeping and bed. So doing something like reading a book under some dim light or reading a boring newspaper article, something just calming and distracting on the couch, and then waiting until your body starts to feel sleepy again, and then go back to your bedroom and give yourself another chance to fall asleep. And you might have to do this 2 or 3 times, but what it is training your body again to associate bed with sleep, and it's really important. So another more complex version of this is to spend less time in bed. So in terms of people with cancer and going through treatment, we see a lot of people have a lot of tiredness and fatigue and feel like rest is very important. And it absolutely is. Although people change their routine to maximize their sleep window, often going to bed earlier and staying in bed later. So again, the problem here is you're spending more time in bed trying to go to sleep than actually sleeping. So for example, someone might say, oh, I only get 4 hours sleep a night, but I'm spending 12 hours in bed. So this is inefficient, and it's likely contributing to your brain associating bed with lying there awake rather than actually sleeping. So what we suggest is actually limiting the time spent in bed. So what we do, this is often best done with a psychologist or a GP or something. So getting some data, using a sleep diary if you have to, about how much time you're actually spending in bed versus spending awake. Getting that data over a couple of weeks and then really slowly minimizing the time spent in bed. So it might look like sort of shaving a couple of hours, like going to bed slightly later and making sure when you wake up that you're actually getting up. And this will mean that when you actually go to bed, you're more tired. And then again, reinforcing that association between bed and sleep. Again, it is important, I think, to do this strategy if you are going to embark on this strategy under the guidance of a professional, because there's a lot of comorbid concerns, mental health, physical health things that if you limit your time in bed too much and you rest too much, it can be detrimental. So take this with a grain of salt, but I guess the overall message is wherever you can safely, limit the amount of time spent in bed trying to sleep. So like all these strategies, everyone's at different stages of their lives and of their treatment. So, and it's not always possible to do everything as best practice recommended in this presentation. So if you're unable to get out of bed for whatever reason, so sit up in bed, turn the lights down to dim, and then again, try and go back to sleep when you're actually feeling sleepy. If you're in hospital for a long period of time, differentiate between the time spent sitting in the chair versus time spent sitting in the bed, and then keeping the blinds up and the lights on during the day to keep some level of normality in that circadian rhythm. So environmental factors such as earplugs, eye shades, white noise machines, which we know are really helpful, and there's a lot of free versions, free apps and YouTube videos and those sorts of things where you can get long period of white noise, which can sometimes be really helpful in blocking out external noise. Another thing to consider is the material of your clothes. Is your bedding too hot? Is it too cold? Is the material irritating? So as I mentioned, people with lymphoma sometimes suffer, unfortunately, from hot flushes or skin irritation. And there's no easy fix for this, but making your environment as optimal as possible for promoting good sleep, making it quick and easy to shed clothes or add clothes as you need, or having a fan or a heater with a remote can be really helpful. What we know is generally a slightly cooler room is optimal for sleep, but this is obviously different for everyone. And it could even look like a form of self-care, of actually going out and investing in a good pillow or a new set of sheets that you really like the feel, and really just building some enjoyable habits and associations with bed rather than this fear of not being able to sleep. So as I mentioned, it's really important to create a ritual and a routine around getting ready for bed. So something that works for you and something that you actually look forward to. So a couple of things to remember when building this ritual is getting ready for bed before you're tired. So many people will notice themselves getting tired on the couch, then take this as a cue to brush their teeth, get into their pajamas, go to the toilet, put the dog outside. And by this stage, people have often woken themselves up again. So in avoiding any energizing activities just before bed. So when you feel tired, you're ready to go. And I've touched on it before, but I'll touch on it again because it's really important. So avoiding, where possible, exposure to screen time and light. The blue light in phones and iPads and those sorts of things can sometimes send signals to the brain which mimics the sun, and it actually wakes us up from a biological level. So I'm not saying to sit in darkness after 7 o'clock each night, but just having an aware of this and maybe looking at putting some filters on your screen, some blue light filters, or just leaving one light on in the lounge room rather than all the lights in the house. And just having an understanding of this and setting up a routine and a ritual that really reliably winds you down and prepares you for sleep. And again, with electronic devices, with notifications and those sorts of things, notifications sometimes can can serve the purpose of just an alarm clock that's just set to go off at any time of the day or night, which understandably is not conducive to having a restful night's sleep. So engaging in good sleep habits. So a lot of people try and keep a regular bedtime, which is really helpful. But more importantly, it's about going to bed around the same time, but focusing on going to bed when you're actually sleepy. So throughout the day, our body will move in rhythms of sleepiness and more awake. So while you might aim to go to bed at 10 each night, some nights you might be really sleepy at 9:30, and other nights you might not be sleepy until 10:30. So focusing more on when you're sleepy rather than setting it to a definitive time. However, on the other side, when you're waking up, it is actually really helpful to set a regular wake time. And when you wake up, to actually get up, go outside if you can, and expose yourself to as much natural light as possible, because this sets your body clock through right from the first thing in the morning. And hopefully at the end of the day, your body knows that it's now time to wind down, and it can really go a long way in setting your body clock. Obviously, it's hard sometimes when you've got kids or different schedules on the weekends, but wherever you can, trying to set a regular wake time can be a really helpful strategy. So I'm just going to quickly touch on this, because I understand that there's some other people speaking today who know a lot more about this, about diet than me. But a couple of things to touch on quickly is things like alcohol might make you sleepy, but it doesn't give you that deep restorative sleep that's most beneficial. Other things to consider are things like spicy foods might actually increase the likelihood of hot flushes or other irritations of some sort. So I think consulting your doctor and your treating team or dietetics team and really talking about how this might be impacting your sleep and bringing that into the conversation can be a really helpful strategy. Exactly the same with exercise. I understand that there's people talking about exercise who, again, know a lot more than I do, but there's proven benefits for across the board with exercise for emotional well-being, physical well-being, including people with cancer. Being busy and active during the day can really promote that healthy circadian rhythm, and I think it's a really important strategy to consider across all mental and physical health concerns. But again, it's important to adjust to your situation from a medical perspective. So for one person, exercise might look like going for a 1 hour walk and going to the gym for half an hour. And for another person, it might just look like simply walking around the backyard for 5 minutes. So really making sure you're doing what you can within what's safe for you medically. So I've already spoken about these briefly, but there's a lot of additional cancer-specific sleep problems that can impact sleep. So things like pain, nausea, hot flushes, toiletry situations, different medications, hormone treatment, all these sorts of things. Often talking to doctors, their focus is on getting the best response from a treatment. And if it's not brought up in these meetings, doctors often don't know how these things might be impacting your sleep. So if you are having bad sleep, I'd really encourage you talking to your doctor and making this a priority for discussion and asking about what additional things that they might recommend based on your personal situation. And some of these things, unfortunately, might not have a perfect answer, but what we know is if you create an environment around some of the issues that may not have a perfect fix right now, it might improve your sleep from a 3 out of 10 to a 5 out of 10. And in the context of what you're going through at the moment, that might be really, really helpful. So managing your mind and emotional health is, as I've discussed, is a really important thing, not just around sleep, but generally making sure you're practicing good emotional health. So there's a lot of self-help strategies that you can do, and I'll speak about a good place to find some of those strategies in a minute. But sometimes speaking to a doctor or psychiatrist or psychologist, these people have a wealth of knowledge that can help tailor strategies to your own personal situations. And sometimes it might not be if you necessarily you're experiencing clinical depression or anxiety. Sometimes it's just helpful to have a space to talk through what's going on for you at the moment, and having a space to get these thoughts out to an impartial person who has some training in the area can be really protective in terms of giving you that quiet mind that's conducive to sleep. So I'm aware of time, so I'll just make sure I get through everything. So in terms of self-care, mindfulness and meditation is really helpful, and there's a lot of apps and CDs and things that can be really helpful in terms of different breathing exercises, different exercises that help quieten the mind. Progressive muscle relaxation is another version of this, where you sort of systematically go through your body and focus on different areas and really breathe into those areas and relax your body. And that's been found to be a really helpful strategy for sleep. One mental strategy that we find is really helpful for people, because often worry is at the core of a sleep problem, and this can override all the good things that we might be doing in terms of our environment. So it's important to find a way to get the worry out of your mind before nighttime and slow your mind down. So one helpful strategy is called worry time or worry schedule. So this is actually about designating a specific time during the day to actively go through all the things that you're worried about, maybe discussing it with a friend, writing them down, going through and seeing what can you control and what can't you control, and making a bit of a plan and setting a timer. And when worry time's over, any other worries you have for the day, just write them down and think, I'll think about them at tomorrow's worry time. So it's about reminding your brain that we're not trying to avoid the worries, but we're going to control when we address them. So I'll briefly touch on this because it's often a big discussion in sleep. So there's a lot of over-the-counter and herbal remedies that might assist sleep, but unfortunately there's very little quality research into the effectiveness of these remedies. Obviously, a lot of people swear by them, and there's a lot of anecdotes historically about different things that can be really helpful. But scientifically, it's hard to distinguish the likelihood between one thing or another thing when it comes to how much value you'll be getting for your money and your effort. And this extends to things like medicinal marijuana and CBD oils, which I understand are gaining a lot of popularity at the moment. However, in Australia, the industry is somewhat unregulated, legally ambiguous, and the current evidence among different populations remains somewhat unclear. I guess to speak any more to this would be outside of the scope of this presentation, and also outside of my scope as a psychologist who doesn't prescribe any form of medication. So I would certainly, as I've said, advocate recommending speaking to your doctor about any additional supplement that you might be thinking about taking. So this also goes for prescription medication. So while the CBT techniques I've talked about today are seen as the gold standard for treatment of insomnia with much better long-term outcomes than medication, for some people, medication in that acute phase may be worth considering. But again, certainly discuss this with your doctor before jumping into anything, as these may impact other medications you're having, and there could be issues with tolerance. Again, with medications, they're often seen as a band-aid rather than a cure. So what we see is they might give people short-term relief, but once they stop taking these medications, the sleep problems can often come back. So it's important to set up your environment around that medication. So making sure you're thinking as clearly as you can, your environment's as good as you can, you're getting regular exercise, your diet's really good, all those things around it. So if you do need to have medication for a period of time, that's really well supported by some of these other strategies. So again, just assistance from health professionals. It's important to note that there's many medical-based problems for sleep, such as sleep apnea and restless leg syndrome, and these should be assessed by a medical doctor or a sleep specialist. So if you believe that there's a medical reason outside of your cancer that may be contributing to your sleep, I'd certainly recommend getting checked out, as there's many people in Australia living with these conditions undiagnosed. So Cancer Mind Care is a website that we developed at Peter Mac, the psychology team, and it's a really helpful resource for people going through treatment and different stages of their cancer journey. For a lot of people, being diagnosed with cancer is the first time that they need to face some big and uncomfortable emotions. And having some knowledge about what symptoms of anxiety and depression might look like and some helpful tips about dealing with them is often really helpful in the first instance. So that's why we made this website, and it's a great resource and something for patients and for families that I would certainly recommend. And to find the Peter Mac Can Sleep booklet, if you just Google Peter Mac Can Sleep, it'll navigate you to a page, and there's a hyperlink there that says CBT self-help booklet. So you can download that as a PDF, and again, it's a really great strategy, a really great resource. So the take-home messages from today is that sleep problems are common, but they're also really treatable. I'd really recommend seeking professional assistance, whether that be through the doctor or the psychologist or your treating team, if need be. Identify all the possible contributing factors that you might have, develop a plan, and really commit to 4 to 6 weeks of implementing this plan. The longer a sleep problem has been going on, often the longer it will take to resolve, but we really know that with some focused energy on it, you can see some really good results. So I'm not sure if we have any questions.
Hi, Jake. Thank you so much for that presentation. I know that it definitely touched on everything that our patients sort of go through. We do have one question that says, what about waking up every day at 3 to 4 a.m. and not being able to get back to sleep? What would you recommend there?
Well, I would recommend, I guess it's hard to give a recommendation without the personal circumstances, but yeah, and I'm a bit hesitant to give specific recommendations, but I guess thinking about what sort of thoughts are going on in your mind when you do wake up, how much is it really contributing to your stress lying there, and potentially getting up at that time and just thinking, all right, this is just a period of time where I might not be able to sleep as much, and then practicing that strategy of getting up, maybe reading something, seeing if you start to get tired again, and then giving yourself another chance. So again, not lying in bed awake for too long is a really first step, is a really good idea. And then having a think about, are the thoughts that I'm having about waking up at that time actually contributing to this ongoing issue with sleep?
Yeah, of course. Somebody has asked, how does CBT work in practice? So
CBT it's cognitive behavioral therapy. So so the strategies that I spoke about are more broad, but I guess the cognitive side of it is your thoughts, your feelings, your emotional, like all the thinking that goes on into a problem. So in practice, it will look like really honing in on what are the key thoughts that you might be having that are maybe contributing to the sleep, and starting to reframe some of those thoughts, like what I said about I can't function, that's a cognition. And then thinking, well, I've managed to get to this appointment today, so I can function. I might not be at 100%, but I'm at 80%, and just softening some of those views. And then behavioral strategies are the other side of it. So it's things like making sure you've got a good routine, making sure all the things around sleep are really good. Like, so it's having a look at it from both sides, the thinking that's going on that may be contributing, and also some of the behavioral strategies that you may be able to implement.
Right.
And so I should note, CBT, oh, sorry.
Yeah, no, keep going.
So I should note that CBT's got a range of evidence, not just for sleep, across all mental health concerns. So it could be that your sleeping problems are actually a symptom of something that might be going on on you during the day life. Like there's a million different things that could be impacting someone's mental health. So yeah, going and speaking to your GP and a psychologist can open that door. And yeah, it could be that fixing some of the things during the day might inevitably lead to a better night's sleep.
And is that your recommendation for people who are in these situations? So I know that Peter Mac has some great, I mean, they've got you guys, they've got a whole team of people who are built to talk people through being able to sleep better. What about people who aren't at a center like Peter Mac? Is there a place that people can go to in other areas? Like, not all centers have such an amazing team, and even people in rural areas, how would you recommend they get in touch with somebody who could help them with sleeping patterns?
Again, it depends on how chronic they are. For a lot of people, will notice that it's probably the norm to experience disrupted sleep around those stressful times around diagnosis, treatment, those sorts of things. So sometimes just implementing some of the strategies in the booklet can be really helpful. Just that's all you need. If everything else in your life's relatively normal and it's just this really stressful time, sometimes just implementing some of these strategies can be great. If they've gone on for a bit longer, I would recommend seeing the GP, asking to get a mental health care plan. So if you go to that Cancer Mind Care website, it really steps through the process and demystifies the process of going to see a GP, what they might ask you, what you should ask for. It's a great resource. And in terms of, like, I work at Peter Mac and obviously have a lot of exposure to people going through cancer treatment. But it's part of the norm in psychology training to get this sleep hygiene information, because it's such a common concern for people across all walks of life, sleep. So most psychologists and counsellors and mental health clinicians have some level of knowledge about sleep hygiene. So linking in with someone, that any sort of health professional, is a great first step.
Great. So you recommend they go see their GP and try and get a mental health plan. It doesn't have to be someone in person either, does it? It could be somebody online that they can link up with that can help them talk through these things. Is that?
Absolutely. Like, through the COVID situation, like, I would see over 50% of my patients via telehealth from all parts of Victoria. So nearly every psychologist is very, very, very used to doing telehealth sessions. And the thing with telehealth is you can do it from, if it's actually opened the doors for a lot of people to get mental health support, because they might not be at a period of time where they can go to all these appointments, and you can really easily share links and helpful strategies and relaxation things via email or via sharing a screen. So I would certainly recommend that. And again, I think it's really important to demystify this idea that you need to have a mental health problem to see a psychologist. Like, this is such a big deal for a lot of people. Sometimes it's just having one or two sessions to just get everything out and not feel like you're burdening your friends or your family, and just have everything out on the table and to someone who's impartial and is ready to listen, can be such a helpful thing to do.
And it is such a stigma attached to seeing a psychologist, I suppose, but really they're just helping you find a way to get through whatever you're sort of coping with. And it's free, I'm fairly sure, if you're on a mental health plan, which I'm fairly certain that every one of our patients would qualify for a mental health plan through their GP. Is that right? It is free for the first certain number of sessions?
It depends who you see. So it's for some people it's subsidized. So some private psychologists might have a gap, but you certainly get a large portion of it paid through Medicare. But most GPs should be able to tell you about some psychologists in the area who bulk bill and often offer reduced rates for people going through different health concerns. So yeah, it's hard to recommend things in the area, but another website's Head to Health for people in Victoria. That's got a really good list of people who might be local to your area.
Perfect. I think there's just a couple more questions we'll get through. What are your views on sleep apps, which you put on when you are in bed, which are supposed to make you fall asleep, especially when you're recommended not to use electronic devices in bed?
Again, it is about trial and error sometimes. Sleep apps And even within the sleep apps, some sleep apps have stories that just sort of go nowhere, and you can get lost in that story, and it takes your mind away from the thoughts you might be having. Some things are really specific breathing exercises. I think the take home message is maybe to tread lightly with all these things and just trial and error and see what works for you, and think, oh, I actually did find that relaxing. I'll try that again, and think, or you might find, oh, that just annoyed me. And it's not necessarily that there's something wrong with you, but it's just not everything works for everyone. So just trial and error. And then once you find something that maybe had a bit of a good impact, just seeing if you can commit to that and see if it starts to help long term.
Perfect. I know it's kind of hard because I'm a typical nurse when it comes to these sorts of things. So when I'm looking after someone at night and they wake up in the middle of the night, I'll often just give them a couple of Panadol and a warm milk. And you know, sometimes they do go back to sleep, but everything will work differently and for different patients. And I know a lot of our patients are on steroids, so that really interacts with a lot of their sleep patterns while they're on those steroids. So, and you covered all of that. So thank you very much. I think that is all the questions for today. I might grab those links off you and we'll be able to pop them in a return email for people tomorrow when we thank everybody. But thank you so much for your time, Jake. I really appreciate that session.
No, you're welcome, Lisa. Thanks everyone for tuning in, and yeah, really, really honoured to be involved.
Thank you for your time.